rightly put it, this morning we are joined by members of civil society. This is a group of civil societies within Uasin-gishu County, but of course they also operate beyond the borders of the county of Uasin-gishu, and mainly they are here to deliberate on issues that have to do with the sexual reproductive health. During this pandemic, Chico, one of the key issues that has been on the forefront, the Kenyans have been talking about it back and forth, is the issue of teenage pregnancies, and you also, like rightly put it, we've had a section of legislators coming up with the sexual reproductive bill. We understand that it has attracted mixed reactions, and we have seen various, groups of the society coming in to weigh in and give their various opinions. It is yet to be, settled into law until such a time that perhaps the country and all the stakeholders will agree on what should be the right legal framework when it comes to matters reproductive health. So in the meantime, they're meeting here today to make sure that they can plan on how they can go out there and get to engage the society, especially members of the clergy who have vehemently opposed this particular bill. So we just want to find out from them what exactly is happening, and perhaps just also talk about the national statistics, and specifically here in Uasin-gishu County, in terms of teenage pregnancy, statistics indicate that the prevalence of teenage pregnancies in Uasin-gishu is actually higher than the national percentage. That just tells you the reason why perhaps everybody should be talking about this, and why the society has to have a candid discussion on matters that have to do with reproductive health. Without much ado, allow me to talk to them and get to hear some of the answers and issues they're going to discuss. To begin with, maybe just bring us up to speed why you had this kind of organization this morning, and what is on your menu.
Thank you so much. My name is Mark Wanjohi. I work with DSW, and today we are meeting civil society organizations working in the North Rift region and also in Kenya, but those who are in Uasin-gishu for today. And our main aim is to discuss reproductive health issues. For example, recently we've had very many discussions around teenage pregnancies and them spiking, especially after lockdown. And we also it has not yet been passed because there's a lot of heat from the religious leaders. What we're encouraging all of us is tunasema umoja ni nguvu, utengano ni udhaifu. All of us, we can come together as civil society organizations who are here. They have realized that we can come together as people working in the government and also the religious leaders, ili tuweze to discuss all the issues around the reproductive health bill, what is good, what is not bad, and what needs to be clarified. Because we know and we believe that the bill, if enacted, it has some benefits for the young people. It provides for the reduction of teenage pregnancies. When you talk about adolescent sexual reproductive health policy of 2015, there's some things which need to be implemented by the county governments with regards to health. So what can we do together? What can we improve? Is it having youth-friendly centers? Is it having commodities in health facilities? Is it training our health workers? What can we do? So for us, it is a call to action. One, to address the issues within the bill and have a consensus with all of our stakeholders, including the religious leaders. Two, is also work together as CSOs and AMLIF. We are gaining momentum towards World Contraception Day, which will be on 26th of September. So in this day, how can we discuss issues of contraception? What does it mean? So that we can justify all these things and tell people that, hey, you can go to a health facility, access quality health services, not a course.
Enough, Mr. Oye. Maybe my other question would be, from your experience in the course of interaction with the county governments, do you think they're giving it, the enough emphasis in terms of even budgetary and planning?
Okay. We've done some budget studies as an organization, and we have seen no one to use evidence. We have seen some gradual increase, although sometimes there's a decrease and an increase, but this calls for a need to sensitize the leaders and let them know that when you invest in health, you're not just investing in health, but you're investing in young people who will be the catalyst of growth for tomorrow. So we would like to say, to request them to approach this issue from a scientific point of view and see the need, and see that when a young girl gets pregnant and they're not able to access some health services because that health facility does not have those commodities, we're actually not supporting their future. So we want to request them to, at least as they continue, they have been, in all over the counties, they have been trying to allocate resources, but they should, for example, come up with clear budget lines on sexual reproductive health and family planning, for example, and be clear and say this amount of money, which is 100 million, is going to be used for example, trainings, commodities, establishment of youth-friendly centers where they can access all these services.
Do you think the conservativeness of our society, the society we are born in, the Kenyan society, is equally an impediment when it comes to having this discourse about reproductive health?
It is, and in fact I liken it to burying our heads in the sand. That's the way an ostrich can do. I think it is about time for us to be very intentional and very open and say that tuache kuambia watoto walinunuliwa kwa supermarket. Be very intentional and be very clear. For example, when we talk about reproductive health issues, let us not use coded language. Let us just be pragmatic and let's be very practical on this approach. And for example, be it appropriate. For example, the way you explain these issues of reproductive health to a 17-year-old and an 18-year-old is not the same as they are going to do it for a 9-year-old. Although we've had cases where we have 9-year-olds getting pregnant and also delivering babies. So there is a need for us to rise up, be very open, parents to talk, teachers to talk, leaders to talk, so that we can be able to move forward.
Thank you. You told me your area of specialization has to do with mental health. Where does it come in this whole discussion around reproductive health?
I'm Tracy Lumbasi from the CEO of the Mental Health Care Organization, and for us, mental health comes into sexual and reproductive health rights in terms of increasing the sexual agency, addressing sexual coercion, especially for young children, and addressing sexual trauma. So we are increasing sexual agency for children, youth, in terms of letting them know that they have the capacity to choose, to make decisions. They have the right to their own sexual orientation, sexuality, gender expression, gender identity, in terms of they have the right to choose different safe sex practices. They have the right to decline or with consent into sexual behaviors. So that's what we're doing as how mental health is integrating with sexual and reproductive health rights, increasing sexual agency, addressing sexual coercion, and addressing sexual trauma, in terms of which is as a result of rape, defilement, harassment, and very, very heartbreaking, the defilement and rape of children.
Thank you very much, Ms. Lumbasi. On your part, why should you be part of this discussion? Maybe from the course of your work, why should we be part of this idea that everyone seems to be talking about?
Thank you so much. My name is K24. I work with an organization called Reproductive as the team leader. So just to answer your question, and I'll be very brief about it, there's need for youth and other stakeholders in this particular case, the young people. As you know, the definition of a young person, according to the WHO, is a person who is 10 to 24 years old. So there are the barriers that affect their access to quality and quality access to reproductive health information and services. So this can be addressed by us being able to advocate for youth-friendly services. This as just as Mark, my fellow partner, was able to say, we need to be able to come together and be able to address certain issues. So some of these issues is making health practitioner be able to understand the need for a young person to be able to access such services. You know, as I said, the definition of a young person is from the age of 10 to 24. At this particular time of the COVID period, most of them were at home, and our parents maybe were able their parents were at work, and you don't know what they're doing at a particular time of the day. So being able to give them confidence and being able to make them know that these services, that reproductive health services that are able to be received at a particular center, or making other centers aware of other information, what can I call it, services at a particular area, makes them be able to be confident and be able to have less fear in terms of accessing these services.
I'm running out of time. This issue, our students, do you think it's also an issue that is affecting most of the learners, especially those at tertiary levels, issues of mental health?
Okay, thank you. My name is Laura Kimani. I'm the local officer of SCORA. We are an University School of Medicine. So, as a local officer for SCORA, we usually advocate for sexual and reproductive health and rights. And as university students, most of them, they might have the information about sexual health and reproductive rights, but accessing the services like maybe using the contraceptive, they can't use them although they know the information. So you have to teach them so that they can be able to go and access the services.
This is a discussion we definitely will have found some more time in future to have. Maybe just to wrap up this whole discussion, what do you have to say?
Okay, I'm Masi Kyoko. I'm CEO and founder of Entrustive Platform, a youth-driven and youth-based CBO in Uasin-gishu. And in our organization, to go through the financial document, such as the County Integrated and Development Plan, the CIDP, which states that there are some programs or plans that the county government has put in place on behalf of the citizens or the community members in Uasin-gishu. So in our organization, based on the document that we have seen, the county has stated that they are going to establish some facilities known as the youth-friendly centers in the 5 years of the government running, but it has not taken place. So our part is to take part in public participation forums. This is where the government or the country of Kenya gives an opportunity to the citizens to give their views on the budget cycle process. So when we take place in these sittings, we share our issues, we give even solutions using memos and ask the county government to see or to keep doing what they stated in the CIDP, like implementing the youth-friendly centers. And with this, every young person, based on the issues you've had, at least they'll have a center where they can be helped. Yes.
Asante sana. Wanjiro, there you have it. You had various issues, of course, various leaders also talking about the different areas of expertise. And it's a huge discussion or debate that is not going away anytime in the near future. The reproductive health is here to stay with us, and perhaps they're hoping that going forward, all the stakeholders are going to find a consensus and as a country have a legal framework on how we can be dealing with these issues. Back to you.
Right. Thank you so much, Timothy Simo. And indeed, it's a vast discussion on matters reproduction health bill. For now, we cross